Hi, Eastchester. My name is Dr. Collins. I'm the District Medical Director, and I've been asked to review some safety tips as we go into this holiday season. So first, I wanted to review how we can make some holiday celebrations low risk. So by far, the safest way to celebrate is with our household members only, or if we're going to be celebrating with folks outside our household, to do that virtually. Getting together with others outside our household and in person carries risk. So things to think about when getting together with family members or friends or returning college students is that these folks are all outside our household and carry with them some risk of exposure to COVID-19. If your family decides that it's worth that risk to celebrate with others outside the house, then keep in mind some of these facts, right? So celebrating outside and distanced is lower risk than coming inside and being distanced, which is still lower risk than having a small group, which is more than 10 people. And that activities that you do during your celebration, such as alcohol, having loud music and singing, shouting to be heard over music and crowds, all increase the risk of transmitting coronavirus and other viruses during your celebration. So things to think about if you are getting together with folks either in your household or additional family and friends. So first and foremost, please stay home if you're sick. And this applies to all degrees of illness. So a mild sore throat, mild tiredness, a little runny nose. We've seen in many cases, especially during the second wave, very mild symptoms which are indicative of COVID-19. The second is to wear a mask for as long as you can and the great majority of getting together. Obviously, more difficult when you're eating, but aside from that, having a mask on at all times. Additionally, the recommendations are to not share food or drink. So if you are getting together with folks outside your household, have each individual household bring their own food and drink. And then these, of course, all the other infectious disease precautions, such as washing our hands and keeping a safe distance from others, and being mindful of travel considerations. So one thing to think about if you're getting together with folks outside your household is if others had to travel, because airports, planes, trains, group carpooling home from college for our college students returning home, all travels risk. And if you and your household members are going to be around other groups of people, then that risk is also affecting you and your family. Those who should avoid in-person gatherings. So we've talked about the safest by far is to just celebrate with your household. There are some recommendations from the CDC, from the New York State Department of Health, our Westchester County Department of Health, that strongly discourage these folks from avoiding any in-person gatherings. So that's folks who have COVID-19 currently or have been exposed in the last 14 days. The recommendation is to not host or participate in any in-person gathering if anyone in your household has COVID-19 and has not completed their isolation or quarantine, if they have symptoms of COVID-19, and this is what I was speaking of earlier with regards to runny nose, fever, cough, chills, stomach upset, nausea, diarrhea, new rashes, fatigue, aches and pains. If you've been tested for COVID-19 but don't have your results yet, if you've been exposed in the last 14 days, or if there's an increased risk of severe illness, due to your own medical problems or someone in your household. So if you live with someone who's at increased risk of severe illness, someone elderly with multiple medical problems, lung disease, diabetes, obesity, then you're attending an in-person event with folks outside of your household will inevitably bring that risk home to the person who is medically fragile at home. So what should I do if I am traveling over the holidays? So this is a brief summary of the New York State travel guidelines. So if you're going anywhere less than 24 hours, there's nothing to do. You can go on your trip of less than 24 hours and come back. If you're going anywhere for more than 24 hours, it really depends on which state you're traveling to. So states that are contiguous with New York, being New Jersey, Connecticut, Pennsylvania, Massachusetts, and Vermont, you can go for your celebration and come back and not worry about any further steps outside of monitoring for symptoms, washing hands, staying distance, wearing masks, all those things. If you travel anywhere else, so any other state or country, for more than 24 hours, then the guidelines are that you have to quarantine for 14 days when returning to New York. So quarantining means that you are in your house. As a student or staff member, you can't attend school in person. You can attend virtually and can't leave the house for 14 days as you monitor your health. The second option with this, if you don't want to do the quarantine, is to test out 3 days before returning. So if you go to any of these other states that are not contiguous with New York, 3 days before you come back to New York, you have to get a test which is negative. And then the 4th day after you return to New York, you have to get another test. And if both are negative, you don't have to do the 14 days. You do have to quarantine inside your house for 4 days coming into New York from any other state, other than these states in letter A here that are contiguous with New York. So the tricky part with this is getting tested before you leave that other state. And if you're not tested while you're in the other state, then the full 14-day quarantine is required. Okay, so next I'm just going through a couple questions that have come up with our nurse's office. So the first is, I'm going to test my child for COVID-19, though I have not been asked to do so. Should I let the school nurse know? No. Yes, please. Even if you're testing for an asymptomatic screen or you're going somewhere over the holidays that is requiring a test, or you're flying somewhere and the airline's requiring it, please inform the nurses so that they can track results and the prevalence in the school. Okay, the next question. What's the safest way to welcome out-of-state guests or returning college students back into our house? So the safest way is for folks outside of New York, outside of the contiguous states, to still follow those guidelines that we talked about on the previous slides, right? So if they're coming from any other state than these, New Jersey, Connecticut, Pennsylvania, Massachusetts, Vermont, they have to get a test 3 days before coming home, stay isolated at home in a room for 4 days, then get tested again, and then they are safe to come out of quarantine. That applies for the college students in our family and out-of-state guests who are coming to stay in our homes here in New York. Okay, someone from the school told us to quarantine. What does this mean, and when will I be contacted by the Department of Health? So quarantine to review means that there was someone who had COVID-19 who exposed your student or staff. And the requirement for this is to have that person maintain 14 days in the house, as isolated as possible from the rest of the family. So that means that your student or child will stay in one room, preferably with access to just one bathroom that no one else uses, that they'll stay in that room, they'll eat in that room, they can do virtual school from that room every day, updating you as the parent and the Department of Health on if they develop any symptoms. So we are starting contact tracing as soon as we find out about cases, and we're also letting the Westchester Department of Health know, and they are very busy. So there may be a lag time between when the Department of Health calls you and when the school calls you, but please take the school's call very seriously and start to quarantine. When we have a positive case, we are really trying to slow this spread. And so the importance is to start the quarantine right away as you wait for the Department of Health to contact you. They will eventually, it just might not be as soon as you hear from the school. Other resources, the CDC has a host of really helpful sites. These are some of the links here under considerations for events and gathering, guidelines for hosting, travel during COVID-19. The New York State Department of Health website also has a lot of great information on traveling safely. Overall, the main message is please stay home with your household contacts to celebrate. Remember those very basic things that we've all become familiar with as far as washing your hands, staying socially distanced, and we will all try our best to keep the whole community safe during this second wave of the pandemic. Thank you for listening, and I appreciate your attention.